Oh, are we going?
We're good.
Oh, okay. Dr. Saitta here today with Stephen Brooks.
Hi.
We're going to talk about skin cancers. Do you have any questions about skin cancers?
Yeah, what causes skin cancer, Dr. Saitta?
Well, most skin cancers are caused by the cumulative exposure to the sun, and basically what that means is your exposure throughout your whole entire life. But the worst sort of exposures happen when you're from 12 to 21. So that's the most important time to practice sun protection.
So are you saying it's too late for me?
It's never too late to practice good sun protection. And the most important thing is sunscreen. Do you use a sunscreen?
I do, but I'm not sure what the right one is for me and for my kids. Can you help me
Of
pick
course.
the right sunscreen?
My favorite sunscreen are Neutrogena brands, only because you need a stable molecule in a sunscreen, and Neutrogena has a very stable molecule called helioplex in it. So when you're looking for sunscreens, you want to look for that molecule in it. And I always say the higher the better, because the more you put on, the better it's going to do, the longer it's going to stay, and the more protection you're going to have.
If a patient comes to you with a sunburn, how do you treat the sunburn?
Well, I treat sunburns usually in my office with a topical medication. I like steroids because they decrease the inflammation. And my most favorite steroid is Topicort spray. Topicort spray. Sprays are really good to use when you have sunburns because the majority of sunburns happen on people's backs. So, the Topicort spray can be turned upside down and squirted in such a manner and still work properly.
And how do I know if I have skin cancer? What does it look like?
Well, there are three main flavors of skin cancer. The first is called basal cell, and that looks like a pimple that never heals. And then you have squamous cells, and what they look like is these really red but rough areas, and they feel very gritty, like sandpaper, or almost like you're being pricked with a thorn. You can feel them on your skin. And last but not least, you have melanoma, which is the most dangerous and deadly skin cancer, and it looks like a black or brown dot, normally looking like a mole that outgrows itself and grows a lopsided manner.
So